Assalamualaikum warahmatullahi wabarakatuh. My name is Maharani and I will present my presentation about society attitude towards people infected by COVID-19 in their environment. Okay, this is my timeline. First, I will explain about the introduction. Second is the literature review. Next is research methods. Then findings, discussion, and last is conclusion. First chapter is introduction. First, I will explain about the pandemic COVID-19. The international world in 2020 have been shaken hard by the global pandemic crisis COVID-19, and WHO on March 2020 made this outbreak as a global pandemic. The increase in positive cases was made the Indonesian people have several perceptions and attitude in preventing the spread of COVID-19. Even so, the public perception is very good. They know the dangers and also understand the health protocol in preventing COVID-19. Okay, in their environment, society will find people around them infected by COVID-19. Of course, the society will feel worried and afraid they will infect by this virus. So, the purpose of this article is to find out the attitude taken by the society towards people infected with COVID-19 in their environment. This is the following 4 questions to guide my research. First, about what does society think about COVID-19? Second, where does society know the information about the COVID-19 virus? And what was society first attitude when there was a positive case of COVID-19 in Indonesia? And last, what is society attitude when someone is infected with COVID-19 in their environment? Next, it is about the literature review. On this section, I will explain 2 components. First is about theoretical framework, and the second is empirical review. First, theoretical framework. I'm using the concept about attitude for my research. Attitude is a form of response given by someone to an object or an incident. The response given can be either positive or negative. According to Aswar, there are 3 components of attitude, namely the cognitive evaluative response component, the affective component, and the last is behavioral component. These 3 components can support the attitude of a person in their daily life. First, the cognitive component is an aspect of attitude related to knowledge known by humans. Then, the affective component is the feeling or emotion of an individual towards the object or subject. It can be in the form of likes or dislikes. While the behavior component is a tendency to respond with certain behavior to an object or activity. Next is the literature review. I'm using 3 other similar studies for my base research. First, based on study conducted by Sukesi et al., which investigate the knowledge and attitude of the Indonesian people towards COVID-19 prevention with the participation of all health students who are currently studying in Indonesia. This research shows that the knowledge and the attitude of health students about the prevention of COVID-19 in Indonesia are good. This can prevent the spread of COVID-19 transmission in Indonesia. With this research, it proves that if someone has high knowledge of COVID-19, it will encourage a positive attitude in dealing with this pandemic. Second is study from Itzna et al., which state that COVID-19 can have a psychological impact on someone. During this pandemic, Indonesian people feel fear, worry, and this is the normal situation. And the last is study from Milan, which state that the high number of positive COVID-19 in Indonesia result in a negative stigma towards people who infect with this virus. The negative stigma is like discrimination. However, the behavioral components provided by the community are not only negative stigma. Support and emotional attention from the people, such as family, friends, are certainly needed. Without knowledge, the public will certainly have negative attitude, such as discriminate against people infected with COVID-19 in their environment. Okay, next section is research method. This study used a qualitative research and the interview method. And this research was conducted in areas with positive cases of COVID-19, namely in Puri Balicatur Asri Village, Gambing Subdistrict, Sleman, Yogyakarta. Okay, the participants in this study were 3 participants who are residents of an area that have a case of COVID-19. They were selected because they live close by people who are positive COVID-19 and have a high risk of contracting the virus. And in this study, I used semi-structured interviews and the data collection instrument in the form of notebooks, voice recording device, and writing instruments. Okay, this is the step how I conduct the interview. First, I contact the participant and explain about what kind of interview and also the questions. After that, I'm using WhatsApp voice message to conduct the interview. The next step after the interview, I collect and analyze the data from the participant. And last, I make the conclusion about my result. Okay, next is the findings or the result from the interview. Okay, I divided into 3 parts: respondent knowledge, respondent attitude, and respondent behavior. Okay, the respondent knowledge from the interview, it can be found whether the participant has good knowledge about COVID-19 or not, and where the participant found the information. Next is respondent attitude. First, the initial condition experienced by participants when there were positive cases of COVID-19 in Indonesia. And the second is the initial attitude of the participant when they knew that there is someone who was infected with COVID-19 in their environment. And last is the attitude that participants take after knowing that people who are positive for COVID-19 have recovered. The last is respondent behavior. The participant behavior towards people who are infected with COVID-19 and the action during this pandemic. Okay, next session is discussion. From the interview, the participants have a good understanding of COVID-19 because they get the information from social media, conventional media, and the local government by socialization using posters. Next, the respondent attitude. Based on the interview, the initial condition experienced by participants when there were first positive cases of COVID-19 in Indonesia and when they knew that there is someone who was infected with COVID-19 in their environment were shock, fear, and panic. Then, after 1 year with this pandemic situation, the participants are no longer panic, but they still continue increase the health protocol and the immune system. Also, there's participants who blame the government because they are not being responsive in overcome the COVID-19 virus problem. And last, the participants' attitude towards people who recover are different. Some participants treat as usual and other participants still stay away from them. And last is the respondent behavior. Okay, the participants are not sent or give the negative stigma, but they are giving support like material and moral. Okay, from the result of the interview, the 3 participants have positive attitude and action towards the victim of COVID-19. It is because they have high knowledge about COVID-19. The study demonstrates that someone will have a positive attitude if it's supported by a high level of knowledge about the COVID-19. And with positive attitude, people will give positive behavior to people infected with COVID-19 in their environment. Another similar study conducted by Yanti et al. is the first study in Indonesia that identify knowledge, attitude, behavior towards social distancing. And in this study, the results of research show that the Indonesian people have good knowledge about the virus, and the Indonesian people have a positive attitude accompanied by good behavior towards social distancing to prevent the transmission of the COVID-19 pandemic in Indonesia. Okay, last section is conclusion. This study explains about society attitude towards people infected with COVID-19 virus in their environment. This study proved that the society need to have high knowledge, positive attitude, and positive action towards people infected with COVID-19 in their environment. And this study is a small scale. I suggest for the future study to use more participants, especially participants with different ages and different education background, so that the result will be able to present more data. Okay, I think that's all from my presentation. Thank you. Assalamualaikum warahmatullahi wabarakatuh.